When I want to deliver the bad news to the family of the patient, I want the earth to swallow me. This is the feeling. I don't want to face them with this. But at the same time, when I deliver good news to a patient family, this is also so rewarding. I am Dr. Talal Ahmad Reda from Egypt. I am a resident consultant cardiothoracic surgeon in Gleneagles Kota Kinabalu, Sabah. Number one, the introduction of the minimal invasive surgery, coronary artery bypass surgery, which is through a small incision not involving the cutting of the sternum itself. And number two is the off-pump coronary artery bypass grafting, which is performing the coronary artery bypass surgery while the heart is beating, without stopping the heart, without the use of heart-lung machine. Number three is the introduction of the ECMO, or what we call the extracorporeal membrane oxygenator machine, which is a very advanced machine that is helping the heart and the lung, which are failing in some of the patients. And in critical condition, this machine will last on the patient ranging from 7 days to 30 days. After that, we wean the machine and the patient will become normal again or return to his normal activity. Number four is the introduction of a quality control machine, which is called a time transit flow meter. This machine will measure the flow of blood across the grafts at the end of a bypass surgery. So we make sure that the grafts are functioning well and there are no question marks around the flow or the graft patency. He's a young man, 39 years old. He's actually from Sandakan. After we accepted him in our hospital, we put him immediately on the ECMO machine. During that time, his lung, the ventilator settings were brought down to minimum, and his lungs were allowed to rest for his stay on the machine for 32 days. Those 32 days were really challenging case, because we had not only to manage the lungs to let them rest, we had to manage complications in the liver, on the kidneys. We had to do some dialysis to support the kidney. So it's a multidisciplinary approach to treat the patient. So almost all of the hospital specialties were involved in this patient. This also includes all our nurses in the ICU. And it requires a very qualified nurse in the ICU to manage the ECMO. And also we had our perfusionist. Our perfusionist is the one managing the machine itself technically and troubleshoot if any problem happened to the machine. So this case was quite challenging for 32 days. All of us were supporting the patient 24/7. Any small complication will make bigger complications that we can lose the patient. So precision in management is very crucial in these cases. At the end of the 32 days, it was very rewarding. We were able to wean the patient from this machine. The patient was able to go to the ward, stay for 2 months, another 2 months for rehabilitation, and he was able to go back to his wife. His wife was very supportive. She stayed with him in the ICU. She always encouraged him by using a video call with his children, with his 2 sons, which was very touchy to the whole team. It made me think not to give up again. I would like to see the introduction of the robotic surgery, which is becoming more popular and more common all over the world now, which is called robotic-assisted cardiac and lung surgery. The advantage of the robotic surgery is being so precise. Let me tell you about that there is no shaking of the robotic arm. If the surgeon hand is shaking a little bit, the robot itself will abolish this shaking at the end, which is one of the big advantages. Another big advantage is that if you need an expert surgeon to do overseas surgery in another hospital, he can sit in his own hospital on the console controlling the arms of a robot in another overseas surgery. The famous surgeon to repair the mitral valve did a transatlantic surgery while he is still in his country and the patient is another country. So this is a very big advantage. And in the presence of the 5G networks nowadays, the availability of 5G with no latency, which is very important in transmitting the movement of the surgeon and the movement it will reach at the same time with no latency, no delay, this is becoming very possible. So the future is very bright about using this. And it's allowing us to do things that we never dreamed of doing this before. Yeah, this is very promising. I hope the introduction of new technology to our cardiothoracic surgery field, I hope I will catch most of them before I retire, but I'm telling that the future is really very bright using the technology that will save more lives with no complications, and this is all for the good of humankind.